We've talked a lot about magnesium deficiency and what it does to us. Now let's look briefly at how it occurs. Although there is plenty of magnesium in the Earth's crust and also dissolved in the oceans, it has become deficient in our diet. Now, magnesium is the central atom of the chlorophyll molecule. So, green vegetables are generally good sources of magnesium. It is found in the outer surface of grains and nuts and legumes. But when grains are processed, the magnesium-rich layers are removed. And nowadays, farming practices deplete magnesium and other nutrients from the soil, which is the only source of magnesium in the vegetables and livestock that we eat, so it can make our food deficient in magnesium. Farm crops are selectively bred and genetically modified to increase yield, that is, bushels per acre, and not necessarily nutritional benefit. I can assure you that the big food and farming industries do not have any tests to evaluate the magnesium content of their vegetables and grains. So you are the one who must do something about this. Now, your body does all it can to save magnesium. Magnesium is carefully preserved by the kidneys, and it is reused in autophagy. However, a little magnesium is lost every day because it cannot be all reabsorbed as the blood is filtered by the kidneys. So about 120 milligrams is lost daily in the urine. The practice of drinking large amounts of water every day adds to this loss. You see, the excess water that has been drunk is removed by the kidneys, but the magnesium that water has absorbed cannot all be removed from this water as it's filtered, so the practice causes washout of magnesium and other minerals. Now, and vigorous prolonged exercise, it results in large amount of sweating, and heavy resistance exercise that leads to muscle growth or damage also requires extra magnesium to recover. Also, magnesium is present in the skin cells, the hair, the gastrointestinal cells that we lose daily. So, 70% of people living in developed countries are now magnesium deficient due to changes in eating habits and agricultural practices. We have only 25 grams of it in our body. The body doesn't keep any really in reserve. Although some can be borrowed from bone and muscle, and we can function to a certain extent with less magnesium than is optimal, major health consequences are likely. This means it must be replenished daily. Meat and dairy are not abundant sources of magnesium, so for adequate intake of about 350 milligrams daily for women and 550 milligrams for men would require eating fruit and green leafy vegetables, whole grains, legumes, nuts, that sort of thing daily. But eating a large amount of magnesium-rich foods has some risks as well. This is an area that really requires some education. Since foods that are rich in magnesium are often high in toxins, and those toxins are oxalates, lectins, gluten, and seed oils, such as linoleic acid, then this could lead to complex health problems. Let's consider oxalates first. Oxalates are abundant in many of the foods that we consider to be very nutritious. Now, this is a chemical diagram of sodium oxalate. Anyone with any kind of chemistry in their background will be startled by the oxalate structure. And these are sodium oxalate crystals. I think it's quite clear from their structure they are highly inflammatory. And they are removed only with great difficulty by a major inflammatory process in whatever tissue they get deposited in, whether it's in the subcutaneous tissue, muscles, brain, or kidneys. Please let me recommend this book by Sally K. Norton, Toxic Superfoods. Here she describes the diseases and medical problems that stem from oxalate overload. They can include fibromyalgia, rashes, osteoporosis, kidney failure, kidney stones, leaky gut syndrome, dementia, sarcopenia, and even worse. If we're going to solve our magnesium issue by changing our diet, we have to look at these foods very carefully and make sure they're not high in oxalates. First, let's look at foods that are good sources of magnesium, but are also high in oxalates. There's a list of them, and I'll just read this off. Spinach, turnip greens, beets, beet greens, chard, most beans, and most nuts actually, almonds and cashews especially, dates, chocolate, and spices such as black pepper, turmeric, and cinnamon are all great sources of magnesium, but all of them are high in oxalates and can be a substantial oxalate load. And also tea is a big source of oxalate. All of these can add up to a real overload and a real health problem. Now, green leafy vegetables contain a large amount of chlorophyll, so they can be expected to be good sources of magnesium. Low oxalate green leafy vegetables include bok choy and collard greens and kale, romaine lettuce, and a few others. Most leafy greens that are low in oxalates, though, are moderate or low in magnesium. So while these green vegetables are safe choices, they are not abundant choices. Now, as I mentioned, this requires education and study, and we'll continue to emphasize looking up the oxalate content and the magnesium content in all the foods that you choose to manage in order to manage your magnesium level. Now let's consider nuts. Most nuts are high in magnesium, but also high in oxalate. Macadamia nuts, pecans, and walnuts are the three good ones. They are high in magnesium and low in oxalates, so they would be a good choice for providing magnesium and avoiding oxalates. The rest of the nuts are high in oxalates. Now let's consider fruits. Fruits also give us multiple choices in magnesium and oxalate content. High magnesium fruits include bananas and avocados, blackberries, raspberries, figs, papayas, guavas, grapefruit, melons, dried dates, and kiwi. So that's a bunch of them, but let's look at high oxalate fruits. They include kiwi, if you eat the skin, raspberries, starfruit, dried figs, and dried dates. So you need to know that. When you're choosing the fruits that you eat, avoid those 6 that are high in oxalates, or else limit them. Don't totally avoid, but limit them. Low oxalate fruits include apples and peaches and apricots and bananas and a lot others. I'll just continue to caution you. Look this up if you're attempting to manage things like magnesium by increasing the plant foods in your diet. This precaution is necessary when our goal is a high magnesium diet that avoids plant toxins. Now, if I've gotten your attention about oxalates, that's good. For more excellent information for you and your family, I recommend Sally K. Norton's book, Toxic Superfoods. It's a great source, all sorts of interesting material, but you also have to go to the internet and look up the contents of magnesium and oxalate and other toxins in everything you choose. Internet sources are helpful, and Google can look up magnesium and oxalate contents of virtually all foods. Let me give you a quick example on my cell phone. Okay, to look up oxalate in spinach, I open Google and enter oxalate in spinach. Choices appear, and I choose oxalate in spinach, and it tells me and reassures me that it is definitely high in oxalate. Not much more I need to do to know that I have to limit my spinach intake. Now let's discuss gluten and related toxins found in grains that are recommended for their high magnesium content. Now, this is a gluten molecule representation. This also is a bad actor. It has a complex protein and carbohydrate structure that is tough on the gastrointestinal system, and once it gets into your body, into the whole body, and it can get in too. Although whole grains can be an abundant source of magnesium, they also contain toxins that can cause significant and even severe health injury, and gluten is one of those toxins. It's a really big one. Problems include disruption of the microbiome, causing severe dysbiosis and direct attack on the sealing mechanisms of the gastrointestinal system. And this can cause severe immune disease and severe systemic illness and direct attack on the central nervous system, causing a variety of neurological illnesses, including depression and even schizophrenia. Now, grains do serve as a significant source of magnesium, which is present in the outer husk of the grain, but much of this magnesium is lost when the grains are processed. The magnesium in grains is not very bioavailable because of the phytic acid that binds the magnesium in grains. The wholesome whole grains that we hear so much about are not so wholesome. And I suggest that you limit your grain intake. As a source of reference on grains, I recommend William Davis's excellent book called Wheat Belly, and he also has a companion volume called Wheat Belly Total Life Plan. And also David Perlmutter's book, Grain Brain. Both of them are world figures, respected professionals in their professions, and also very well educated and great educators themselves on the topics of grains and their toxic potential to you. Next, let's discuss lectins. Lectins are complex protein and carbohydrate plant toxins present in many of the vegetable foods that are good sources of magnesium. Now, this is a pictorial representation of a lectin molecule. This molecule is not easily digested, and it is free to attack the gastrointestinal lining until it is passed or digested. And it attacks at several levels. It can cause leaky gut syndrome and then systemic inflammatory disease, and can disrupt the microbiome, causing gastrointestinal dysbiosis, which in turn causes an associated depression and even dementia. As a source and reference for lectins, I recommend Dr. Stephen Gundry's excellent book called Plant Paradox. Dr. Gundry is a cardiovascular surgeon, and he is also a world-renowned expert in food and nutrition, and especially on this subject of lectins. Plant foods that are high in lectins include beans, nuts, grains, including wheat, corn, barley, and rice, most of them that we eat in the U.S., and also others like tomatoes, potatoes, eggplants, peppers, and seeds such as sunflower seeds. There are fruits and vegetables that are low in lectins, which include celery and lettuce and many others, but we must be careful with all vegetables that we choose when optimizing our magnesium intake. Lectins can be managed to a certain extent by pressure cooking and that sort of thing, This also requires some education to know all the ins and outs of managing this complex issue. Obviously, loading up on plant foods could lead to all the problems associated with high lectin intake. Just as with oxalate and gluten, their presence and concentration in the various plant foods that you choose should be researched, and overload on lectins should be carefully avoided. Unsaturated fatty acids present another challenge with plant foods, or the so-called polyunsaturated fatty acids. Linoleic acid is one that is really in the news now. You hear the most about it. This is a chemical diagram of linoleic acid, and this is a chemical diagram of linolenic acid. Both are polyunsaturated fats, somewhat different though. Both of them are susceptible to oxidation if they're cooked. And that's not good, because oxidation changes that angle, and that angle is a major part of the function of that molecule once it's incorporated into cellular structure. That is something that we should be very careful with, and unfortunately, linoleic acid is a major constituent of the seed oils, the industrial seed oils that we are using so commonly now in Western civilization. Now, nuts, including almonds, pecans, and walnuts, are high in linoleic acid, and this is an interesting issue that is not completely resolved. Nuts in our diet can be compatible with good health, but cooking nuts could oxidize the linoleic acid and lead to illness. The two double bonds that make it susceptible to oxidation can always be damaged if the cooking temperature is too high. Linoleic acid now is overly abundant in our diets in developed countries, and that's because of the technique used to produce industrial seed oils that are used in cooking and ultra-processed food. All the seed oils, including canola, soy oil, corn oil, sunflower, safflower, cottonseed oils that you find on the labels are loaded with polyunsaturated fatty acids, including linoleic acid, that have been damaged by heating. Heating these oils in the manufacturing process leads to oxidation and highly inflammatory derivatives, which can cause chronic dysbiosis, obesity, type 2 diabetes, cardiovascular disease, and dementia, all of which are the endemic diseases in our population now. This is a subject that we all need to learn more about. I recommend that to learn more about industrial seed oils, read Dr. Catherine Shanahan's excellent book, Dark Calories. In this book, she does a great job of describing and explaining much of what we need to know about polyunsaturated fats, and she also gives us much of the history behind the great cholesterol myth and the diabolical people involved in creating our current health crisis. With what we now know about linoleic acid, it seems reasonable to have nuts and other seeds in moderation in our diet. And I will say that the macadamia nut is the only nut that is an excellent source of magnesium and is also low in linoleic acid and in the other toxins, including oxalates, that we have to avoid overloading with in our foods. So let me summarize. Loading up on plant foods in an effort to obtain adequate magnesium is treacherous, although that is exactly what is recommended by many experts in nutrition. Adding large amounts of nuts and seeds to the diet to improve magnesium intake can increase our already high consumption of linoleic acids, as well as all the other toxins that we have discussed throughout this presentation. Before making major dietary alterations, look carefully for naturally occurring plant toxins in every vegetable and every grain that you eat in your daily diet. Now, this is a lifetime's task of reading and education, and you must take this task seriously. Most physicians have been taught nothing about nutrition or supplementation, so your doctor may not have this information. That means that you need the information, and then you must make informed decisions about how to manage magnesium in the management of your own strength, health, and wellness. Many people find it to be simple and convenient to make some reasonable adjustments in their diet in order to increase magnesium while avoiding plant toxins. And also, in addition, to add a magnesium supplement to their daily plan. And I think that's a reasonable way to approach it. Another issue here is, if it's so important, why don't we just take large amounts, put it in all of our food, and then not worry about it? The answer to that is that it can be toxic in large doses. Oversupplementation may cause immune deficiency, weakness, low blood pressure, lethargy, and mental dysfunction. Now, I should emphasize that oversupplementation is generally not a problem except in people with kidney failure. If there are any issues involving the kidneys, the treating physician should be consulted and a plan established for supplementation and management. Blood tests for magnesium levels are not easy to interpret, so a qualified medical practitioner would need to closely follow supplementation, diet, and all the blood tests. Now, there are several magnesium preparations available. They vary in their absorbability in the gastrointestinal tract, and that makes a big difference. Those that are absorbed in the stomach and upper intestine generally do not cause gastrointestinal distress, and they do not have a laxative effect. And these are magnesium L-threonate, magnesium glycinate, magnesium taurate, and magnesium malate. They're all well absorbed in the upper intestine and stomach, so they do not have a laxative effect. Magnesium threonate is the one that has been extensively studied for its ability to cross the blood-brain barrier and for its effect on brain function. Magnesium glycinate, taurate, and malate are probably as beneficial in the central nervous system as is magnesium threonate, but threonate is the one that has been studied the most. Glycinate, for instance, has the advantage of bringing glycine along with the supplementation, which can be helpful with neurological function as well. Magnesium citrate is absorbed less in the upper intestine and is often used as a powerful laxative in hospitalized patients, and I don't recommend it for home use. Magnesium oxide is not absorbed to a significant extent, and it is used as a laxative because of its osmotic effect of drawing water into the colon. So supplementation at home with magnesium oxide is not helpful if you're trying to increase your magnesium intake. When supplementing magnesium, the relationship between magnesium and calcium should be considered. These two divalent cations, as you know by now, compete for absorption in the intestine just as they compete everywhere else. So they should not be taken at the same time. So if dairy products are abundant in your diet, magnesium supplements should be taken on an empty stomach to ensure the best absorption. Magnesium supplements taken just before bedtime avoid this competitive absorption, and they improve sleep. Around 500 milligrams of elemental magnesium generally is considered adequate as a daily dose. Now, I recommend, again, Carolyn Dean's excellent book on magnesium supplementation. There's a lot of detailed information there that will be good for a lifetime. Magnesium supplementation can be done safely and effectively, and managing your magnesium intake can be simple and easy. However, I strongly urge you also to learn about foods and your health, and to study the details of everything you eat. Learn about the specific vitamins and minerals and other nutrients in your food, but also be aware of the toxins and anti-nutrients as well. Above all, take control of your health and nutrition. Manage your strength, health, and wellness yourself. They all must be managed together, and no one can do this but you. Well, I hope you liked this presentation on magnesium and its role in your strength, health, and wellness. If you did, please click the like button and then subscribe. We'll be talking about a lot more interesting and vital topics as time goes on.